If you've been diabetic for a while, there's a decent chance that your feet hurt. If you're not diabetic, there's a decent chance you know a diabetic, and there's a decent chance that their feet hurt. Diabetes damages our nerves over time and can cause pain and numbness, commonly in the feet and hands. Can taking a pretty mild supplement called alpha-lipoic acid, ALA, help with diabetic neuropathy? That's what these guys tried to figure out in one of the most sizable and impressive supplement studies I've honestly ever seen. This was the Neurological Assessment of Thioctic Acid in Diabetic Neuropathy 1 trial, somehow shortened to Nathan-1. Thioctic acid is another name for ALA. It was a randomized, placebo-controlled, double-blinded study. That's what we like to see. Randomization was good, inclusion and exclusion criteria were reasonable, the primary outcome was a validated nerve testing protocol, and they had people in the trial for 4 years. They also measured a bunch of secondary outcomes, and we'll touch on that later. About half of the 460 patients recruited were given 600 milligrams of ALA, and half were given matching placebo pills. Probably because the trial was so long, a huge number of people quit taking their ALA supplements and their placebo supplements, about 180 out of the 460. They still collected their data and did what's called intention to treat analysis, which is widely considered standard right now, and that means they analyzed the data on everyone that they enrolled and randomized in the trial. That has its own issues that we'll touch on later. Honestly, the methods were pretty solid, and I'm not a statistician, but the math also looked good. So what did they find? Basically, no difference in the primary outcome, the standardized nerve testing. They had some slight differences in a handful of secondary outcomes, like some of the individual nerve tests, and also in a standardized score that evaluates patient-reported symptoms of neuropathy. So 2 big things to talk about. First, when you have a bunch of outcomes that you measure, there's a good chance of having a positive trial. We like study authors to say what a primary outcome of a study will be before they even do it, so they don't measure 100 things and tell us later the one positive thing they found was actually what they were looking for in the first place. You can go to a couple websites where researchers will call their shots, so to speak, before they run their experiments, and sometimes you can catch them in 4K changing up their outcomes when they try to publish. Statistics aren't perfect, and we manipulate them to make educated guesses. When we set up a trial, we use some fancy calculations to decide how many test subjects we need. One part of this is setting what's called an alpha level. Without getting too deep in the weeds, the most common number to set this at is 0.05 or 5%, and what it sort of means is that 5% of the time we'll find a difference between things we're comparing when there isn't really one there, just because of freak chance. That's more common than flipping heads 5 times in a row. It's not super common, but it happens. So if you measure a ton of possible outcomes, you can see how you're just going to get some positives due to chance, roughly 1 in 20 times in this example. Second thing, they used intention to treat analysis, which tends to underestimate the actual effects of a treatment, especially when a lot of patients don't adhere to the treatment, just like in this trial. We'll dig deep into that topic another time. So should our diabetic friends and family take alpha-lipoic acid? This study doesn't give us a great answer, even though it was a lovely piece of research. It might help with mild to moderate neuropathy and prevent it from getting worse, and looking at some other literature, it might actually help with some of the more general metabolic problems diabetics have. Talk to your doctor about it. Better yet, take them some literature and talk to them about it. As always, link to the paper is below, and if you learned something today, kindly help us out by hitting the like button.